Hello, this is Dr. E.K. Tan, and today is the 6th of October 2018, and I'm interviewing Dr. Louis Tan. We are here right now at the 22nd International Congress Parkinson's Disease and Movement Disorders in Hong Kong. Welcome, Louis.
Thank you.
I'll just have to ask you a couple of questions, and just feel free to speak your mind. Could you tell us about your earlier years as well as your education?
Well, I grew up in Singapore and I did all my education in Singapore. I did my medical studies at the National University of Singapore. I trained in internal medicine in Singapore at the National University Hospital, and then moved eventually for my neurology training at the Tan Tock Seng Hospital. After which I was privileged to have a 2-year fellowship around at the Parkinsons Institute, which is located in the Bay Area. And that's where I had opportunity to work with some of the scientists and clinicians like Dan Togasaki, Caroline Tanner, Bill Langston at the Parkinsons Institute. And this was an interesting institute where there was an integration of animal work, basic science work, translational research, clinical care, epidemiology, all in a single institute. So that gave me a good opportunity to see how to integrate research and to translate research from the basic to the clinical. I also had some time with Helen Bronte Stewart also at the Stanford Medical Center, and that was where I was exposed to her work on balance and also on deep brain stimulation.
So thank you. So perhaps I could take you a little bit earlier than that at what point in your training, either in medicine or neurology, that you have decided to specialize in Parkinson's disease and movement disorders?
So this kind of came at a time where there was need, but I think there was a lot of interest and development in Parkinson's disease. This was a time where, almost 20 years ago, where deep brain stimulation was something that was coming in, and it was having a significant effect and impact on our patients. We had the development of new medications during that period. We had the discovery of genes that were associated with Parkinson's disease, and there was all this hope that was there for a cure because of the stem cells and the work that was developing in this field. So I think because of the excitement in the field and all the challenges, I think that was what attracted me, and there was a good match that there was also a need within the department for someone to be trained in the area of movement disorders.
Great. So you have been in the field for now probably 2 decades already, in this particular specialties, and make many stellar contribution, not just to the field but to the International Movement Disorder Society as a whole. You want to share with us, essentially the creation of the Asian Oceanic section of the International Movement Disorder Society and how this has helped the region itself and the growth of this particular specialty.
Well, yeah, it was very much of a privilege because we came back and we were in the field at the time where there was an interest in developing regional sections, and I think we are very indebted to our leaders and the pioneers like Professor Yoshi Mizuno, Professor Bob Yensik, where at that time there was already a patient meeting that was going from country to country within Asia. And at the same time with the patient meeting, there was also a small satellite clinical meeting. So there was a group of friends that we had formed. We knew key people from each of the countries, and that made it easier for us to form the section. And I think we had the first regional meeting in Asia, and I think the first regional meeting, a congress in the whole of the MDS that was hosted in Singapore. And this was more than 10 years ago. And I think we were very proud that we in Singapore could actually kind of birth and played some part in the birth of the Asian Oceanian section, and also to be the first to host the Asian Oceanian Parkinson's and Movement Disorders Congress, which has now flourished and grown and has gone to many countries over the years.
So within the section itself, the AOS section, you have made, I think, enormous efforts itself in pushing for educational programs and the initiation of the visiting professorship and also link up some of the smaller programs within Asia. So you want to share with us, your thoughts on this, and how these efforts have been actually translated into better educational programs within the region, and perhaps training better movement disorder neurologists in this particular region.
Yeah, so I think we are very indebted that the Movement Disorder Society has been able to support all the many outreach programs like the Developing World Educational Causes, the Visiting Professorship, the Ambassador Program, that allowed the region to run many causes in different cities, in different countries, that otherwise would not have access to movement disorders education. So we could go down to the cities and have the doctors and the residents come, whether it be in India or Nepal or Myanmar or Laos or other countries in the region. And now we are moving into the Middle East and Central Asia as well. So we are very glad that I think in the end, when we can educate the doctors, the nurses, the therapists and the trainees, I think and feel that we have done a part in helping the lives and improving the quality of care of patients who suffer movement disorders across the region.
So, over the last 20 years in the field, could you share with us your proudest moment or key milestones itself, in this particular field?
Yeah, so we are happy in Singapore, and a lot of the work is done together with EK, and we are glad that I have been a part to do some large epidemiological projects which have been done in Singapore. We are one of the few large cohorts in the world where we are prospectively following patients and evaluating their dietary and lifestyle habits to see what increases or reduces the risk of Parkinson's disease, along with a whole lot of clinical studies. And we are very glad now that we have a few cohorts that we can look prospectively over time, a population cohort, early Parkinson's cohort, a clinic cohort, that we can actually look at the disease progression and what modifies this disease. I think as you would know, I think this year we were very proud, EK and I together with two other basic scientists were honored to receive the President Science Award in Singapore, and this is a prestigious award that was given to us. And I think this is a culmination of the work that I and we have done over the years relating to Parkinson's patients, the epidemiology, the clinical studies, interacting with the basic science studies, the translational work that EK and the basic scientists have been doing. And I think this was one of our proudest moments where we could have the results and award that shows basically 2 decades of work and friendship that we have had.
So, talking about President's Award, I understand that you have some special President's Award from the Movement Disorder Society. You want to share with us?
For the movement disorders, I also am grateful that I think 2 years ago we were honored, myself with Professor Bidyasari from Thailand, to have a Distinguished Service Award. I think this was in appreciation for the work that we did in organizing the Pattaya Congress. This was one of our Asian meetings under quite difficult situations, because in Thailand there was a crisis, there was some protests, and there was a lot of concern about having the meeting in Bangkok. And so we had to move it to Pattaya and convince everyone that Pattaya was safe. And in the end, we had a very successful meeting. And so I think we were appreciated for that work, but I think we were also grateful for the support from the whole region to come to Pattaya, even though at that time, there were some questions about the safety issues within Bangkok itself.
So great. I think perhaps I could ask you, what advice would you give to a young doctor, young physician, and young neurologist, or young scientist who are entering the field of neuroscience or movement disorders, and who perhaps come from a place where the infrastructure and financial support is not there? And what kind of advice would you give them?
So I was thinking of this question, and I think there may be 3 things that we can think about. Firstly is, for the younger doctors to be willing to work hard to do their best in whatever they do and whatever responsibilities that are given to them. I think a standard of excellence is important, to basically strive for the best in whatever is given to them. Secondly, I think to continue to keep learning, to be humble, to be open to not just academic learning, but also I think life skills learning, that sometimes we need to learn how to interact with people, how to operate within a system, how to work with others, individuals. And I think we need to be continually learning, being humble and being open to feedback and growing. And thirdly, I think to be willing to step forward to contribute, because there are lots of opportunities within the movement disorders field itself. And I think the Movement Disorder Society has given many opportunities for the younger ones to be trained, to receive travel grants, to be a part of the society. And I think we just want them to step forward, to be courageous, to put up their hands and to be willing to volunteer and to do their best when they're selected to do a task or perform a task, however small it may be.
You want to share with us that, from all the achievements that you have had, at any time over the last 20 years that you have experienced any bias or obstacle, that somehow hold back a little bit of your career development, or if they are not self, whether in the either in neuroscience or the movement disorders field, whether there are any bias, against or for, any groups or specific obstacles that young people may encounter.
So I'm actually very I feel very supported in my journey, and I think I'm very grateful for many people, particularly within the organization, the MDS itself. And I remember the leaders like Professor Gunther Deutschel. I've worked with Cindy Kamela, for Claudia Tranquilda, for Chris Getz, for just giving opportunities to people like myself and others, specifically to me, to have opportunities to be a part of committees, to take part in projects, to chair various committees over the years. And I think that without these opportunities, then it would have been very difficult for me to be able to contribute. But I'm grateful for even the opportunities and for support of them and all the other leaders within the MDS, both in Asia as well as internationally, that has enabled me to basically continue contributing to the society.
Perhaps I could ask you the last question. I know you have 3 great children, a great family. You want to share with us your, perhaps some of your proudest achievements by your kids, in despite your busy schedule, and how do you manage actually not just your work-life balance, but provide support for your children themselves as they're growing up?
So I'm very grateful and very blessed for my wife and 3 children who are in their teens. And I think in the end, I think family is still important. At the end of the work day, we go back to our families and we want to be able to support them, want to grow them, want to be able enable them to do their best also and to provide for them. So I think ultimately it's the support in the home, and for my wife, who is able to manage the home so that I can be able to be involved in and go away for trips, for the involvement in the Movement Disorder Society, only because there is a stable home and a stable home environment where she is looking after the children and the family. So I think I'm forever grateful for that and feel very blessed to have the family that is well and is supportive in all that I do, and a wife who is facilitating and helping that. In the end, at the end of the day, with the work and the other contributions that we make, the family still is important, and it's from there that we are able to do what we can do outside of the family.
So, what people say, is right, that behind the success of every man, there is a woman. Thank you, Louis, for your time.
Thank you so much.